Welcome to MCQs Master 101. If you're preparing for the Nclex RN, this video is a must-watch. Today, we'll cover 50 Nclex priority questions you must master, focusing on ABCs, Maslow's hierarchy, patient safety, and delegation. Pause before each answer, think like a registered nurse, and test your readiness for exam day. Let's get started. Question 1. A client suddenly becomes short of breath and anxious post-op. What is the nurse's priority action? A. Check the surgical site. B. Administer pain medication. C. Assess airway and breathing. D. Call the healthcare provider. Correct answer, C. Assess airway and breathing. Airway and breathing take priority according to ABCs. Question 2. Which client should the nurse see first? A. Client with chronic back pain rating 6 out of 10. B. Client with oxygen saturation of 88%. C. Client requesting discharge teaching. D. Client awaiting lab results. Correct answer, B. Client with oxygen saturation of 88%. Low oxygenation is life-threatening. Question 3. A post-operative client reports chest pain and shortness of breath. What is the priority nursing action? A. Obtain vital signs. B. Administer oxygen. C. Call the rapid response team. D. Reassure the client. Correct answer, B. Administer oxygen. Immediate support of oxygenation is the priority. Question 4. Which client should the nurse assess first during shift change? A. Client with blood glucose of 250 milligrams per deciliter. B. Client with sudden confusion and slurred speech. C. Client with controlled hypertension. D. Client awaiting discharge. Correct answer, B. Client with sudden confusion and slurred speech. Possible stroke requires immediate intervention. Question 5. A client has a potassium level of 6.2 milliequivalents per liter. What is the priority assessment? A. Bowel sounds. B. Lung sounds. C. Cardiac rhythm. D. Urinary output. Correct answer, C. Cardiac rhythm. Hyperkalemia can cause fatal arrhythmias. Question 6. Which intervention has the highest priority for a client with active bleeding? A. Apply pressure to the site. B. Check hemoglobin. C. Start IV fluids. D. Administer pain medication. Correct answer, A. Apply pressure to the site. Stopping the bleeding is the immediate priority. Question 7. A confused client attempts to climb out of bed. What is the nurse's priority action? A. Apply wrist restraints. B. Move the client closer to the nurse's station. C. Call security. D. Administer sedatives. Correct answer, B. Move the client closer to the nurse's station. Least restrictive safety measure first.
Question 8. Which client can the nurse delegate to a UAP? A. Client with chest pain. B. Client requiring insulin. C. Client needing vital signs. Or D. Client with new onset confusion. Correct answer, C. Client needing vital signs. Routine, stable tasks can be delegated. Question 9. A client with asthma is wheezing and using accessory muscles. What is the priority action? A. Encourage fluids. B. Administer bronchodilator. C. Obtain peak flow reading. Or D. Notify provider. Correct answer, B. Administer bronchodilator. Immediate airway intervention is required. Question 10. Which client should be transferred to the ICU first? A. Stable diabetic client. B. Client with sepsis and hypotension. C. Client controlled pain. Or D. Client awaiting surgery. Correct answer, B. Client with sepsis and hypotension. Unstable circulation requires intensive monitoring. Question 11. A client reports sudden severe headache and neck stiffness. What is the priority action? A. Administer acetaminophen. B. Perform neurological assessment. C. Dim the lights. Or D. Encourage rest. Correct answer, B. Perform neurological assessment. Possible meningitis or hemorrhage. Question 12. Which client is at highest risk for aspiration? A. Client with dysphagia. B. Client with constipation. C. Client with hypertension. Or D. Client with anxiety. Correct answer, A. Client with dysphagia. Impaired swallowing increases aspiration risk. Question 13. A client becomes unresponsive. What should the nurse do first? A. Call the provider. B. Check pulse and breathing. C. Obtain vital signs. Or D. Document findings. Correct answer, B. Check pulse and breathing. Immediate life assessment comes first. Question 14. Which client should the nurse see first? A. Client with fever of 38 degrees Celsius. B. Client with sudden drop in urine output. C. Client requesting pain meds. Or D. Client scheduled for teaching. Correct answer, B. Sudden drop in urine output. Indicates possible acute kidney failure or shock. Question 15. A client with diabetes is diaphoretic and shaky. Priority action. A. Check blood glucose. B. Administer insulin. C. Provide IV fluids. D. Notify provider. Correct answer, A. Check blood glucose. Symptoms suggest hypoglycemia. Question 16. Which finding requires immediate intervention? A. BP 140/90. B. HR 110. C. Stridor. D. Pain score 7/10. Correct answer, C. Stridor. Indicates airway obstruction. Question 17. A post-operative client has a saturated dressing. Priority action. A. Change the dressing. B. Reinforce the dressing. C. Check vital signs. D. Call the surgeon. Correct answer, B. Reinforce the dressing. Control bleeding before further action. Question 18. Which client can be assigned to a new graduate nurse? A. Client on ventilator. B. Client with unstable angina. C. Client receiving oral antibiotics. D. Client in shock. Correct answer, C. Client receiving oral antibiotics. Stable client is appropriate for new staff. Question 19. A client with burns has decreased urine output. Priority action. A. Increase oral fluids. B. Assess IV access and fluids. C. Administer diuretics. D. Document findings. Correct answer, B. Assess IV access and fluids. Indicates possible hypovolemia. Question 20. Which client should the nurse assess first after a fire alarm sounds? A. Ambulatory client. B. Client on oxygen. C. Client sleeping. D. Client watching TV. Correct answer, B. Client on oxygen. Highest safety risk during fire. Question 21. A client reports calf pain and swelling. Priority action. A. Apply heat. B. Massage the area. C. Assess for DVT. D. Encourage ambulation. Correct answer, C. Assess for DVT. Risk of pulmonary embolism. Question 22. Which task should not be delegated to a UAP? A. Ambulation. B. Feeding. C. Intake and output. D. Client assessment. Correct answer, D. Client assessment. Assessment requires nursing judgment. Question 23. A client suddenly develops hypotension and tachycardia. Priority action: A. Administer oxygen. B. Check lab results. C. Notify provider. D. Document. Correct answer, A. Administer oxygen. Supports circulation and tissue perfusion. Question 24. Which client should the nurse see first? A. Client with nausea. B. Client with chest tightness. C. Client with headache. D. Client with insomnia. Correct answer, B. Client with chest tightness. Possible cardiac event. Question 25. A client with a tracheostomy has copious secretions. Priority action: A. Change dressing. B. Suction airway. C. Provide oral care. D. Deflate cuff. Correct answer, B. Suction airway. Maintains airway patency. Question 26. Which client requires immediate intervention? A. Client with mild dehydration. B. Client with blood glucose 180 milligrams per deciliter. C. Client with altered mental status. D. Client with controlled pain. Correct answer, C. Altered mental status. Indicates possible hypoxia or neurological issue. Question 27. A client experiences anaphylaxis. What is the priority medication? A. Diphenhydramine. B. Epinephrine. C. Corticosteroids. D. Albuterol. Correct answer, B. Epinephrine. First-line treatment for anaphylaxis. Question 28. Which client should the nurse assess first? A. Client with productive cough. B. Client with sudden vision loss. C. Client with fatigue. D. Client with constipation. Correct answer, B. Sudden vision loss. Possible stroke or retinal detachment. Question 29. A client on opioids has a respiratory rate of 8 per minute. Priority action: A. Encourage deep breathing. B. Administer naloxone. C. Apply oxygen. D. Notify provider. Correct answer, B. Administer naloxone. Reverses opioid-induced respiratory depression. Question 30. Which intervention is the nurse's highest priority for a client with fever and neutropenia? A. Encourage fluids. B. Administer antipyretics. C. Initiate infection precautions. D. Obtain blood cultures. Correct answer, C. Initiate infection precautions. Prevents life-threatening infection. Question 32. A client reports sudden onset abdominal pain and rigidity. Priority action: A. Administer analgesics. B. Assess for peritonitis. C. Encourage ambulation. D. Document. Correct answer, B. Assess for peritonitis. Potential surgical emergency. Question 32. Which client should the nurse monitor most closely? A. A client with mild anemia. B. A client with elevated INR. C. A client with controlled asthma. D. A client awaiting discharge. Correct answer, B. Elevated INR. High bleeding risk. Question 33. A client has a new onset seizure. Priority action: A. Restrain client. B. Protect airway. C. Administer sedatives. D. Document event. Correct answer, B. Protect airway. Prevents aspiration and hypoxia.
Question 34. Which task is appropriate to delegate to an LPN? A. Initial assessment. B. IV push medication. C. Wound dressing change. D. Care planning. Correct answer, C. Wound dressing change, within LPN scope. Question 35. A client with CHF reports increased shortness of breath at night. Priority assessment. A. Weight. B. Lung sounds. C. Bowel sounds. D. Skin turgor. Correct answer, B. Lung sounds. Indicates pulmonary congestion.
Question 36. Which finding indicates the need for immediate action? A. Slight edema. B. Crackles in lungs. C. BP 130/80. D. Fatigue. Correct answer is B. Crackles in lungs. Suggests fluid overload. Question 37. A client's IV infiltrates. Priority action. A. Slow infusion. B. Remove IV. C. Apply heat. D. Document. Correct answer is B. Remove IV. Stops tissue damage. Question 38. Which client is most unstable? A. Client with controlled diabetes. B. Client with GI upset. C. Client with internal bleeding. D. Client with mild anxiety. Correct answer is C. Client with internal bleeding. Threatens circulation. Question 39. A client reports sudden chest pain radiating to the arm. Priority action. A. Obtain ECG. B. Administer oxygen. C. Check labs. D. Provide reassurance. Correct answer is B. Administer oxygen. Immediate support for myocardial ischemia. Question 40. Which client should the nurse assess first during rounds? A. Client with nausea. B. Client with low oxygen saturation. C. Client awaiting meds. D. Client requesting food. Correct answer is B. Low oxygen saturation. Life-threatening condition. Question 41. A client has a blood glucose of 45 milligrams per deciliter. Priority intervention. A. Administer insulin. B. Give oral glucose. C. Start IV fluids. D. Recheck glucose later. Correct answer, B. Give oral glucose. Immediate correction of hypoglycemia. Question 42. Which client is at highest risk for falls? A. Client with hypertension. B. Client on sedatives. C. Client with diabetes. D. Client with anemia. Correct answer, B. Client on sedatives. Impaired alertness increases fall risk. Question 43. A client with pneumonia has increasing respiratory distress. Priority action. A. Increase fluids. B. Administer oxygen. C. Obtain sputum sample. D. Provide chest physiotherapy. Correct answer, B. Administer oxygen. Supports breathing. Question 44. Which client should the nurse see first after receiving report? A. Client with pain 8 of 10. B. Client with sudden hypotension. C. Client requesting assistance. D. Client awaiting discharge. Correct answer, B. Sudden hypotension. Indicates possible shock. Question 45. A client with a head injury becomes increasingly drowsy. Priority action. A. Administer sedatives. B. Perform neuroassessment. C. Encourage sleep. D. Document. Correct answer, B.
Perform neuroassessment. Possible increased intracranial pressure.
Question 46. Which client should be assessed first in the emergency department? A. Client with sprained ankle. B. Client with abdominal pain. C. Client with difficulty breathing. D. Client with headache. Correct answer, C. Difficulty breathing. Airway and breathing priority. Question 47. A client receiving blood transfusion develops chills and fever. Priority action? A. Slow infusion. B. Stop transfusion. C. Administer antipyretics. D. Notify provider later. Correct answer, B. Stop transfusion. Suspected transfusion reaction. Question 48. Which client is most at risk for infection? A. Client with diabetes. B. Client with neutropenia. C. Client with obesity. D. Client with hypertension. Correct answer, B. Client with neutropenia. Low white blood cell count increases infection risk. Question 49. A client with COPD becomes cyanotic. Priority action? A. Encourage coughing. B. Administer oxygen. C. Obtain ABGs. D. Call respiratory therapy. Correct answer, B. Administer oxygen. Corrects hypoxia. Question 50. Which client should the nurse see first at the beginning of the shift? A. Client with controlled pain. B. Client with active GI bleeding. C. Client requesting discharge papers. D. Client awaiting labs. Correct answer, B. Client with active GI bleeding. Immediate threat to circulation. Well done for completing these Nclex priority questions. If you can confidently answer them, you're developing the critical thinking skills the Nclex demands. Don't forget to like this video, subscribe to MCQs Master 101, and turn on notifications for more high-yield Nclex practice. Share your score in the comments and keep practicing. Your RN success is within reach.